My name is Laura Olkeby, and I was diagnosed with pelvic congestion syndrome in June of 2022. And in today's video, I want to talk about the specialist that I actually saw to get properly diagnosed and then treated. And I think it's important because, as I've shared before, my path of getting a proper diagnosis and treatment was long, arduous, and unnecessary. And so, if I can help anyone move any bit faster on their diagnosis and treatment, that would just mean everything. Because again, it took me years to get properly diagnosed. But then once I was, it took only weeks to be treated and to start having relief. So I want to talk to you a little bit about, from my experience, who was it that I saw and how was I actually properly diagnosed. One resource that I want to bring out, though, if you're continuing to look for more information on this or if you're experiencing symptoms, I came across this only after I was treated, and it's called Pelvic Congestion Syndrome, Chronic Pelvic Pain, and Pelvic Venous Disorders. It is written by Professor Mark S. Whiteley. He is the founder of the Whiteley Clinic in the UK. And so for anyone who's currently doing research on pelvic congestion syndrome, the Whiteley Clinic might have come up in your research. And, a lot of women, no matter where you're located in the world, consider going there to get treated because they do just seem to be an expert and have really great reviews from patients. But it is really not maybe probable or possible, maybe due to logistics or financial reasons. And so when taking a look at how I could get treated by a specialist, I ended up finding the term interventional radiologist. And so that's the term that I found when I was seeking treatment for pelvic congestion syndrome. And this again was finally the moment that I got information that made sense, reasons behind the why I felt so badly. And what's even better, I had hope because I had a treatment plan. And so in this book, if I can just read an excerpt from Professor Mark Whiteley on page 31, he's talking about varicose veins. A lot of people that have pelvic congestion syndrome, myself included, have varicose veins in the legs. And he writes, there's something quite comforting about considering treatment to veins that are in the leg. The veins are relatively near the surface, and if anything goes wrong, it's quite easy to either place compression on the leg or to cut down and operate on the vein directly. I'll pause there. I've had, honestly, probably 8 or 9 treatments now on different veins in my legs. And yes, it's relatively easy. I can do it over lunch. It's not as concerning, right, for the person that has to do it. But to write back, Professor Whiteley talks, conversely, veins inside the abdomen and pelvis lie behind the bowel and organs of the abdomen and pelvis. They lie deep inside the body, and not surprisingly, this makes doctors and nurses more anxious about any treatment for them. He then goes to talk about doctors and nurses find it very difficult to understand and diagnose things that they cannot see. And so you can read more about what he writes about it. He's just a very, patient-focused way of writing the book, but it is for medical professionals as well. But I think that's important to really highlight that doctors and nurses really find trouble diagnosing things that they cannot see, because what happens for a lot of us is we're seeing our primary care doctor or end up in an emergency room because the pain is so intense. We get rung through the traditional images and scans and tests for doctors to see, right? So what does that look like? That's going to be an X-ray, an MRI, a CAT scan, an ultrasound, an intravaginal ultrasound, blood work. And what are they looking for, right? They're looking to try to see anything in any of those images. And so I had all of that done over years. And every time, everything was coming back with nothing, right? There's nothing in your blood work. There's nothing showing up on any of these scans, which is a good thing, right? Because you're also trying to discount, like, could there be a growth in there? Could there be cancer? Could there be a tumor, right? Because the pain is so intense, you're like, there must be something there. And what are doctors and nurses seeing when they see these traditional images? They're seeing nothing. And so how I ended up finally in a specialist's office is there appeared to be some slight inflammation in one of the MRI and CAT scans that I had done in emergency room, but it was suggested, like, we think it could be, right? But it wasn't definite. When I finally was in the room of the specialist, and again, this was an interventional radiologist at Johns Hopkins as a part of their interventional radiology department, that's when we were able to definitively really talk about, like, okay, all of these images are showing nothing in terms of growths or tumors. Your blood work looks fine based on the symptoms that you're telling me, and some of my history, right, my medical history. She said, I think it's very likely that you have pelvic congestion syndrome, but here's how we go about diagnosing it here at Johns Hopkins, okay? So they do it through a pelvic venography. And what that means is I'm going to go in the morning, and they're going to get me, with an IV put in my body. They're going to insert a catheter into my jugular vein, and they're going to start putting some dye, okay, a dye agent into my blood veins. And while I'm laying down, because I am flat on my back, so I'm not giving gravity any help here, but they also have something in my vein, in my jugular, like I can't be thrashing about. I have to push down, okay, like I'm giving birth, right? I need to bear down, I need to push down to create blood flow in my veins, and that's where they're going to see the dye agent start to get congested. And so when they're able to see in that pelvic venography the dye agent getting stuck, getting congestion, flowing backwards as opposed to upwards, they're going to say, looks like pelvic congestion. We have a solid diagnosis, can confirm. Then they're going to treat it in that same procedure. Like, they don't have to take it out and then ship you home and then bring you back in 2 weeks. Take care of it right there. So the pelvic venography is how the interventional radiologist diagnosed me with having pelvic congestion syndrome. She could see it through the images within the veins that the dye agent was getting congested. She then went and switched into pelvic embolization, and that's the treatment. And so they have different embolizing agents. Johns Hopkins and my doctor had, kind of a little treasure chest that you can choose from depending on factors that they're considering. But they ended up using both coil and then foam to embolize my veins. And I'm not a doctor, I'm just a patient here. But, from what I have heard, basically embolizing these veins, whether it's through coil or foam, it's going to make the vein just collapse around the agent. And then ultimately the blood just reroutes, because the body's amazing. The blood starts to reroute, over the course of weeks and months. And your body just figures it out. And then that congested vein no longer exists. So I share this with you because, as Professor Mark Whiteley wrote about on page 31, he says, doctors and nurses find it very difficult to understand and diagnose things they cannot see. It is very hard to diagnose pelvic congestion syndrome through the traditional ways that we get our images done today. So he does write about the Venix duplex ultrasound scan that they have at the Whiteley Clinic. From my research, and I would say, it wasn't the most exhaustive research, but from my research in the US, I wasn't able to find this machine, at least in the location that I'm here on the East Coast. What I was able to find through my keyword searches was an interventional radiologist. And so the interventional radiologist was able to do this diagnosis through things that they could see through the pelvic venography. And so it's really hard, from my understanding, to treat this or to diagnose this, because the veins are so deep and they are so small, right? In the venography, you see the veins that are blown up and magnified, and the doctors are able to navigate just these like microscopic sized veins, but they're so small. I mean, traditional x-rays are not going to see this. They're not going to cut through all the fat and the muscle and the tissue to see these microscopic sized veins, right? And then they're absolutely not able to see the blood flow. And this is ultimately what the disease is, right? It's a vascular disease where your blood is not flowing properly. And that's where you need to have something like Professor Whiteley's, duplex ultrasound, or within Johns Hopkins, it's going to be a pelvic venography. But it's really important then to get the proper diagnosis from a proper specialist. And so as you're researching, You might get put in front of a primary care doctor. You might get put in front of a neurologist, a gynecologist, a physical therapist. They all have their own specialties and they all have their own experience. But from my experience, this is a vascular disease. This is something that is then treated by a vascular surgeon, an interventional radiologist. And so you really want to eventually get into the room of an interventional radiologist to see if you've got pelvic congestion syndrome and navigate your options from there. So stay tuned for a future video on where I share more about my experience. So again, hopefully you can move faster towards a treatment for your pelvic congestion syndrome.